recommended for colorectal cancer screening, but a recent study published in the New England Journal of Medicine questions the effectiveness of colonoscopies. Joining us is Hartford Healthcare colorectal surgeon Dr. Daniel Lavy with the Digestive Health Center at St. Vincent's Medical Center. Doctor, thanks for joining us.
Thank you for having me.
So the study compared colonoscopies to no cancer screenings, showing that those who underwent the colonoscopy did not lower their risk of cancer death significantly. Will a lower risk of colorectal cancer? Were you surprised by these findings?
Yes, to be honest, at first I was surprised. But once I looked a little bit closer at these results, I realized the headlines were a bit misleading. I can tell you a little bit about the study. It was a large study. It's called the Nordic Trial. It stands for the Northern European Initiative on Colon Cancer. Big study of 85,000 patients from Poland, Sweden, Norway, between the ages of 55 and 64. They divided patients into two groups, those invited to have a colonoscopy and those not invited to have a colonoscopy. The study took place over several years and looked at patients' risk for developing colon cancer and their risk for death from colon cancer. And what did they find? They found that those offered, now offered being a key word, had an 18% lower risk of colon cancer, but the two groups had the same risk of death from colon cancer at 10 years. But if you actually look at those that went through with the colonoscopy, which was only 42%,
all right,
those that actually, yep, go ahead.
Go ahead. I'm sorry. Finish up your point. I'm going to get to the next question.
But in those that actually went through with the colonoscopy, it reduced the risk of getting colon cancer by 30%. And reduce the risk of death from colon cancer by 50%. These numbers basically tell you that this works.
Doctor, what concerned you about how the study was conducted?
There were two main flaws, I think. One was something called ADR, which is called the adenoma detection rate. And it's used to determine what % of your colonoscopy is the doctor actually finding a polyp. And the ADR of these endoscopists was significantly lower than the current standard in the United States. And the second critical flaw, I think, was diversity. Most of these patients were from specific European countries. We know that the American population is much more diverse, and the African American population has a much higher risk of colon cancer. This study didn't really take this into account.
So, doctor, what are you telling your patients about colonoscopies?
That one, colonoscopies don't really do anything if you don't get them. Just getting an invitation for a colonoscopy doesn't reduce your risk of colon cancer, and certainly doesn't reduce your risk of death from colon cancer. It's still the best way we know to prevent colon cancer, and we know that colonoscopies save lives.
And doctor, real quick last question. Are there other options for screening for colon cancer?
Well, I always say that the best test is the one the patient will actually do. There are several less invasive modalities, such as CAT scans, stool DNA tests, but these, for one, aren't as good at checking for polyps, which are precancerous growths. The benefit of colonoscopy, even though it's a little more invasive, is that it's diagnostic and it's therapeutic. So we can take out these polyps before they have a chance to become a cancer.
All right, Dr. Daniel Lavy, colorectal surgeon with the Digestive Health Center at St. Vincent's Medical Center. Thank you for joining us.